Hello, my name is Nicholas Cooper, and I have partnered with the Collective NP Clinic to take a few brief moments to talk about generalized anxiety disorder. Anxiety and generalized anxiety disorder, or GAD, are not quite the same. While anxiety is a normal human experience that can motivate us to prepare, practice, or remain vigilant to our surroundings, generalized anxiety disorder can contribute to feelings of fear, worry, or distress, becoming overwhelming and preventing us from doing daily tasks and activities. Generalized anxiety disorder is common, but very treatable. According to the CDC, anxiety disorders are the most common mental health concern in the United States. An estimated 4.05%, or 301 million people, in the world have been diagnosed with an anxiety disorder, including GAD, as well as 1 in 6 adults in the US. GAD is diagnosed by a licensed professional and, in essence, consists of a combination of symptoms that can include a chronic combination of cognitive, emotional, and physical symptoms. This can include excessive worry or apprehension about everyday life, feeling tense, jumpy, irritable, or restless, difficulty concentrating, racing thoughts, shortness of breath, racing heart, sweating, tremors, twitches, feeling exhausted frequently, difficulty falling asleep, headaches, and an upset stomach. Working collaboratively with your provider to identify your symptoms can help recognize your concerns and make a specialized plan for treating them. While the exact cause of GAD has not been found yet, there are numerous biological changes that we currently believe influence the symptoms that many people experience with GAD. This includes involvement of key brain areas, including those involved in our ability to experience emotions, motivation, executive functioning, and ability to perform tasks, memory making and recall, parts of the brain involved in basic functions like breathing, heart rate, body temperature, and hormone production and release. These changes can include dysregulation of chemical communication between parts of the brain, specifically serotonin and norepinephrine, also known as adrenaline, and GABA. This is the underpinning for many of the psychiatric treatments that we have developed for treating generalized anxiety disorder. We also believe that there is certain environmental triggers that can lead people to have an increased risk of developing generalized anxiety disorder, along with genetic components. Fortunately, there are numerous treatment options available for GAD. Current recommendations include a combination of medications and cognitive behavioral therapy, also known as CBT. But other options may also include complementary health approaches like stress and relaxation techniques, guided meditation, yoga, exercise, and certain medicinal herbs and dietary supplements. It's important to work collaboratively with your psychiatric provider if deciding to use these herbs and supplements, as many of them can interact with medications prescribed. There are many things you can start doing to support your own health and well-being. To start, eating foods rich in omega-3 fatty acids, antioxidants, folate, choline, protein, and vitamins E, K, and B have all been linked to improving brain health and cognitive function. Within moderation, foods like salmon, tuna, nuts, berries, leafy green vegetables like spinach and kale, avocado, eggs, and whole grains like brown rice, quinoa, and oats can all support brain health and well-being. The MyPlate method is a helpful tool that provides an easy way to portion out your meals and has been revised for numerous health conditions, including diabetes and certain heart conditions. Instead of exercise, I often like to say moving your body. This is because there is evidence that different types of movement can support mental and brain health that may not look like traditional exercise. Things like taking your pets for a walk, stretching, or YouTubing a 10 to 15-minute yoga session are great ways to boost the feel-good hormones, boost your immune system, reduce inflammation, and promote brain healing processes. Moderate exercise has additionally supported attention and concentration. A recent study reported that approximately 72% of people diagnosed with GAD had experienced some sleep disturbance or difficulty with sleep. Sleep health has been directly tied to mental, physical, emotional, and spiritual health. Engaging in healthy sleep habits, sometimes referred to as having good sleep hygiene, has been shown to improve symptoms of GAD, as well as numerous other health conditions. This can include simple things like sleeping at the same time each night, avoiding caffeine after 12 p.m., avoiding alcohol or large meals before bedtime, and keeping your bedroom cool, dark, quiet, and without distractions like the TV or your phone. Alternative habits may include reading, listening to music, taking a warm bath, deep breathing exercises, guided meditation, and progressive muscle relaxation. The free CBTI Coach app was developed by the U.S. Veteran Affairs, which provides many mindfulness techniques, journal prompts, and videos to support you in your journey to better sleep. A common symptom of GAD is not enjoying things as much as you once did. We encourage you to begin engaging in those activities again, even if they don't feel as good as they once did. Many people report that, over time, they begin to find enjoyment again. Along with this, engaging in these activities can trigger the memory recall and consolidation part of your brain, providing a healthy reminder of those happy memories. Overall, GAD is a serious but treatable mental health condition that impacts approximately 1 in 6 adults in the United States. It is diagnosed through a thorough psychiatric evaluation completed by a licensed clinician. Current theories believe that changes in the brain, as well as how the brain communicates, is attributed to developing GAD, which is influenced heavily by your genetics and environment. Treatment options are vast and can include a single or combination use of medications, CBT, and numerous complementary health practices. If you have any questions, please feel free to reach out to your provider for additional assistance. It's important to always tell your medical and mental health providers about any changes you make to your medications, supplements, medicinal herbs, or diet. If you begin to experience a medical emergency or thoughts to end your life, immediately contact emergency medical services by either going to your nearest emergency department, calling or texting the National Suicide Hotline 988, or calling 911. Thank you all.